Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hello everybody, I'm Dr. Russell Knudsen.
And I'm Dr. Vikram Jayaprakash.
And welcome to episode 24 of the Hair Loss Show, where we continue our series of treatments on women. So today we're going to talk about something that is what we call off-label, meaning not recommended in our treatment, because we do believe that it has a role if used properly and carefully. So far we've discussed the use of stimulators like minoxidil and laser. We've talked about receptor blockers. And today we're going to talk about enzyme blockade, exactly the same enzyme blockade that occurs in men with male pattern baldness. So just to reiterate the point that in our women, we think there's a variety of causes that are influencing the factors that influence hair loss in female pattern hair loss, whereas in men we know it's pretty much all about the enzyme activity. In women we think it's a combination of enzyme activity, estrogen activity and receptor activity.
Right, so we know what we think, what we've postulated is in women as well, testosterone gets converted into dihydrotestosterone, and there's an enzyme called the 5-alpha reductase enzyme that does that. And this is predominantly the mechanism that happens in men that causes male pattern hair loss, but we think that this also has an impact on women as well. And so
some women have actually had scalp measurements done with biopsies,
right,
of the levels of 5-alpha reductase, and it has found to be elevated. So we're not saying it's true for all women, we know it's true for some women.
So in some women, and we don't, this is not our opening salvo in terms of our treatment modality, but some women we will choose to try and address this mechanism. And how we do that is an off-label use of finasteride, a very low dose of finasteride. But what that tablet does is it blocks that enzyme. If we're blocking that enzyme, we're blocking the conversion of that to that and lowering that in the system. And hopefully you don't get the negative effects of the
Okay,
DHT.
so we're using low dose in women in their reproductive years, but we need to use a higher dose in women in their postmenopausal years. So there was a study done over 10 years ago using low dose finasteride in postmenopausal women, didn't show anything. So we think the inference there is if we're going to use it in our postmenopausal women, we have to use a higher dose. But there's no risk with them being pregnant, so we're not worried about that. In our women in their fertile years, what we're saying to them is you need to have effective contraception.
That's correct.
Because if you read the warnings on the label, you'd think that it's a terrible danger. We don't agree that low-dose finasteride is a terrible danger. The animal studies were quite ridiculous in their dosing, but we also are very, very mindful of the fact and respectful of the fact that women in their reproductive years don't want to take things that could possibly affect a child if they accidentally get pregnant. So again, we do this with a very, very clear understanding that we're using effective contraception in our women and using low-dose finasteride, because we believe that for some of them, blocking the enzyme is not a standalone therapy. We would never, ever use finasteride by itself.
And I think that's a really important point to remember. This is not, if we deal with someone on a day-to-day basis that has female pattern hair loss, we are not reaching for our pad to write a prescription for finasteride. That is not the first thing that we're going to be, the first treatment option we're looking at. It is further down the list, but it is something that's there. So really important, if you are female, if you are suffering from female pattern hair loss, have a look at the other treatment modalities, have a look through our other videos as well. But certainly if you are going to look at this, you need to take good medical advice, get the right sort of advice, and get it prescribed properly. All right,
don't make sure that you're on effective contraception.
That's right. It's really, really
important.
important.
Again, we only just wanted to mention it in passing so that you knew that there were certain women that this might be an appropriate treatment for. I hope you've enjoyed our explanation today of this. Please like us and subscribe to the channel if you continue to want to watch, and we'll look forward to talking to you next time.
Thanks very much.